In Bangladesh, sexual medicine is a taboo factor, and women specifically, we are helping women to realize sexual health is important and these problems can be treated.
And we introduce the new format, new dimension, and new type of treatment in Bangladesh in aesthetic gynecology and sexual medicine.
We are using a fractional CO2 laser for mainly remodeling the vaginal mucosa. It is helpful for vaginal dryness and irritation.
We have a very distinct treatment for men and women for the hormonal imbalance.
Even in the younger age group these days, we are seeing premature ovarian failure and hence early menopause. It is actually related to aesthetic dermatology because we are dealing with pigmentation problems in the private area.
Hello, I am Professor Dr. Mohammed Shamim, leading sexual medicine specialist in Clinic 21. I have been working with this sexual medicine for the last 25 years. I'm working with laser treat and seeing patient every day, every alternative day, and asking about the sexual medicine and all these things. So I thought I have to introduce a specialized clinic for the individuals who are challenging in intimate health and with secrecy, with dignity, and with the holistic approach, and for the state-of-art technology which is compared to the US and Europe.
Hello, I'm Dr. Humaira Bushra Hussain, aesthetic gynecologist at Clinic 21. After passing my MBBS, I did my post-graduation FCPS in obstetric and gynecology, and then I completed my fellowship in aesthetic gynecology. And since the last 5 years, I've been dedicatedly working with Professor Dr. Shamim in the field of aesthetics and aesthetic gynecology specifically. We are working at Clinic 21 to bring a holistic service for both men and women in the field of sexual medicine and aesthetic gynecology.
Actually, this is our dream to introduce this type of clinic in aesthetic gynecology and sexual medicine in Bangladesh. And I'm very much grateful to Dr. Bushra. She is totally dedicated for aesthetic gynecology and the sexual medicine. And we introduce the new format, new dimension, and new type of treatment in Bangladesh in aesthetic gynecology and sexual medicine. In sexual medicine, we are working with counseling, couple counseling. Then we have a very distinct type of treatment like Grow Talk, where we introduce toxins with the growth factors, and we introduced P-shot, O-shot back in 2013, and everyone is doing P-shot and O-shot, and we are actually doing with the T-Lab kits. Actually, it is a European kit. Then we are working with the MCLA chair, that is the electromagnetic force for the pelvic floor muscle. We all know it's around 13,000 contraction within 20 minutes time, right? 20 minutes time. So it will tone the pelvic floor muscle, and which is very, very important for the intimate health and aesthetic gynecology as well. And we have a state-of-art shockwave therapy, which is actually dedicated for the vasodilatation, neovascularization, increase the vascular supply to the penis and pelvic floor muscle as well. So it will give so many benefits for the penile health, and it is directly working for the penile muscles, which will actually tone the penile muscle as well.
Sexual medicine is a taboo factor, and women specifically, they don't even think about it or talk about it in public.
In Clinic 21, we actually address so many problems from the patients. Actually, we all learn from our patients. This is actually much needed services, because all the time patients tell us, sir, we are suffering from these, we're suffering from these. Everyone is telling about the causes, but there is no treatment. Then we thought we have to bring some good quality and branded machines in Bangladesh. So it is not easy, Bushra, right?
No, it is not. We have all the state-of-the-art technology for treating our patients. We are using Lyra diode laser. We are using...
From where? Lyra diode laser?
It's from USA.
Yes, from USA. Actually, it works?
It works really well for female patients.
What type of indications?
Sir, mostly patients with hormonal deficiency who are experiencing vaginal atrophy or thinning of the vaginal mucosa,
the
vaginal
dryness
and
tightening,
laxity, loss of sensation. So these women, they will be helped with this kind of treatment.
Okay, and what is the indication of Mornova for the females and the CO2 laser and the RBM YAG lasers for the intimate health?
We are using fractional CO2 laser for mainly remodeling the vaginal mucosa. It is helpful for vaginal dryness and irritation. Mostly women in around their menopausal age suffer from this type of problems. So therefore, fractional CO2 can be great use for this kind of patients. And then we also use RBM YAG laser and also shockwave therapy with Mornova. So Mornova, I feel, is a wonderful treatment for certain cases, especially women who are suffering from pain disorders, vulvodynia, and loss of sensation. So these kinds of patients, and also it helps a lot with vaginal lubrication and vaginal tightening.
Can you tell what you are actually treating for the women who are suffering from hormonal deficiency?
So firstly, when a woman comes to us, we have thorough investigation of that profile. We do a detailed hormonal profile, and then most cases, if there is any deficiency, for example, in around their perimenopausal age, even in the younger age group these days, we are seeing premature ovarian failure and hence early menopause in certain cases. So this sort of patients, when they come to us, they come with certain symptoms, and we first assess their hormonal profile, and accordingly then we treat them. We are providing hormone replacement therapy. We are giving them patches, injectables, and also oral medication and creams, estrogen creams as well. So aesthetic gynecology is a huge field. It is actually related to aesthetic dermatology because we are dealing with pigmentation problems in the private area, hair issues in the private area, and also sometimes we have to remodel the vulva using fillers, and certain diseases or medical conditions requires the use of Botox as well. So therefore it is culmination of gynecology, which is functional gynecology, because we are restoring the function of the intimate area. And then there is aesthetic gynecology and also sexual medicine, because we are helping women to realize sexual health is important and these problems can be treated. And now in Bangladesh itself, at Clinic 21, we are offering treatment options which are world class. Therefore, women can now come and seek guidance and help from our professionals. So sir, you are the master in fillers and Botox in Bangladesh. So my question to you is, how are we dealing with breast fillers and butt fillers for our women at Clinic 21?
Thank you. Actually, we trained from one Ukrainian doctor back in 2013 for the breast fillers and the butt fillers. We are working with not only HA fillers, we are working with some hydrophilic fillers that last for 3 to 5 years. It's a huge thing. And if there is a saggy breast, then we can also correct it through the fillers with the help of some other devices like candela and the HIFU, HIFU and threads. But there is so many people actually suffering from butt volume loss, and it affects their confidence level. So we actually correct their butt size and the breast size. Can you please describe for the mass people what is Mummy Makeover and how you are dealing with this?
Basically, Mummy Makeover is for the patients or the ladies who have recently given birth or has safely transferred from their postpartum period into their regular activities, and now they're worried about their body shape because now they have a mummy pooch or now have a saggy breasts and stretch marks, and then sometimes they're also experiencing certain problems in their intimate health like urinary leaks, vaginal laxity, and often they complain about lack of libido and vaginal tightening. To be honest, the respective subject is too broad to be discussed in one video.
So that's good. There are so many other things, exciting things in Clinic 21 for the aesthetic gynecology.
Therefore, would be coming up with further more videos in future.
Thank you. See you in next videos. Bye-bye.